Hello, cruel world. 3% of the population experience psychosis at some point in their life. So what is psychosis and what isn't psychosis? What's the difference between being a psychopath and being psychotic? And how does schizophrenia fit into all of these things? What are the subtler signs of psychosis and what are the different causes of psychosis? Does psychosis always lead to violence? And as well as answering all those questions, I'm going to tell you about the case of John Nash, who had schizophrenia but was a renowned mathematician. My name is the ominous Shahominous, or Dr. Shahom Das. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. If you like your true crime with a twist of psychiatry, then this channel is for you. Let's get started straight away. So there are two main symptoms of psychosis, which are hallucinations and delusions. There are other sort of less direct, more subtle ones, which I will come on to, but those are the main ones. So hallucinations are having experiences of things that are not there. So seeing things, hearing things, you can even smell things that are not there, called olfactory hallucinations. Delusions are fixed, unshakable beliefs that don't come from an understandable source. So for example, religious fanaticism is not a delusion because it makes sense of the context of your culture. So to give you some quick examples of cases that I've seen in my work, so I'm a consultant forensic psychiatrist. I reassess mentally disordered offenders. I've seen a man who heard the voice of his abusive stepfather constantly insulting him. I assessed a woman once who genuinely believed that Drake was calling out to her and wanted her to come down to one of his concerts when he was touring in London. She actually went down there, did some very strange things because she was really unwell, including trying to steal a car. I've actually mentioned this on my video about hearing voices. Go 𝐏𝐬𝐲𝐜𝐡, check it out. I have to say that contrary to popular belief, visual hallucinations in psychoses are actually very rare. So visual hallucinations don't tend to happen in things like schizophrenia. They tend to happen in organic disorders. So organic disorders would be things like brain tumors, or when you take mushrooms, like magic mushrooms, hallucinogens. By the way, if you're interested in people going a bit nuts when they've taken mushrooms, I did a video recently on 𝐏𝐬𝐲𝐜𝐡, and he is an MMA fighter. It wasn't him, but within the video I talk about other MMA fighters, including a man, I kid you not, took magic mushrooms, did some sparring with his friend and sparring partner, had these delusional ideas and hallucinations that he was fighting the devil, killed this man, ripped out his organs, ripped out his heart, and cooked parts of him on a grill. I'm not making that up. I know it sounds ridiculous, but that actually happened. Go check that video if you want to know more. I think it's important to say that there's a very real quality to what the psychotic person is experiencing. So when he hears voices, he believes those voices. When he has delusions, he actually, really believes in those delusions. So it's not like a little voice inside your head, but like a loud voice outside your head. Like it feels this real quality, just like you can hear my voice right now. But don't worry, I'm very, very real. I'm not going to tell you to kill everybody, kill everybody, kill everybody. I'm just joking. So I assess mentally disordered offenders for a living. I assess mentally disordered offenders, and one of the things that I use is to tell if somebody's faking mental illness is exactly that. Whether they hear the voices inside their head, which is possible in psychosis, but unlikely, or outside their head. Whereas people who are faking it often believe that voices are heard inside your head. Sometimes they try and fake this so they can get leniency in their charge when they're in court, or sometimes because they want to fake mental illness so they can be transferred to a psychiatric unit as a way of avoiding prison. I've done an entire series on faking mental illness and how I spot these, and I've given you some case examples on this channel. Go 𝐏𝐬𝐲𝐜𝐡, check it out. Always be plugging. So delusions, I told you before, are bizarre, unshakable beliefs. They often take the form of paranoid delusions, hence the term paranoid schizophrenia. So typical paranoid delusions would be people are following me, laughing at me, watching me with video cameras, spying on me, plotting to kill me. But not all delusions are paranoid. You can also get grandiose delusions. And on top of that, you can get even rarer ones like nihilistic delusions. So nihilistic delusions are typical in psychotic depression. So people are so depressed, so severely depressed, that they have these beliefs like the world doesn't exist, or that they don't exist, or that they don't have blood, or that their organs are missing. So they genuinely believe all these things to be true. I've certainly met patients that have had those beliefs in my psychiatric career. So in terms of other types of paranoid delusions, I've assessed a man, for example, who believed for no reason that his neighbour was and tried to attack him with a broom. One of my most tragic and emotional and heart-wrenching cases is of a young girl called Yasmin Khan. That's not her real name, but I've made a video about her, which is also on this channel, and I won't tell you too much detail because I want you to go and see it, but this is a real life case, and she actually ended up killing her nephew, her 3-year-old nephew, because she was psychotic. She believed that he had demons inside him and believed that she needed to heal him. So hopefully I'm painting a picture where in some cases these kinds of experiences can be very intense, and they can feel very real, and they can cause people to do very, very extreme things. The other thing I wanted to say is it's usually to do with beliefs, these delusions, and to a lesser extent to these hallucinations, as opposed to events or memories. So I actually kind of talked about this in my analysis for the Joker, because for example in the film Joker, Joaquin Phoenix believes that he's got this girlfriend, spoiler alert if you've not seen it, but the whole thing's like in his mind. And my point is, this is very unusual. So you don't believe entire events or memories. It's possible, but it's very unlikely. It's more, delusions are more like a feeling rather than an actual event, if that makes sense. So to give you a specific example, a typical grandiose delusion is usually very arrogant or very narcissistic. So it's like the belief that you're exceptionally intelligent, or the belief that women find me attractive, or the belief that I can fly. Coincidentally, all of those things actually happen to be true. But it's important to note that those beliefs feel really, really real, that people actually believe it. And another typical symptom of psychosis is a lack of insight. So that's not knowing that they're unwell. So, you know, the old saying goes that people who are really mad don't know that they're mad, and it's true. Okay, so I mentioned before that those are the main barn door symptoms of psychosis. Those are the things that everybody knows about and talks about. But there are subtler symptoms of psychosis. One of them is called a formal thought disorder. So that is about your thought form. Your thought form is the way that your thoughts are connected to each other. So somebody with a formal thought disorder, they jump between their line of thoughts. So when they're talking to you, they're not making sense because they're constantly jumping between topics. And sometimes they even jump between topics in the middle of a sentence. So to them, they're making sense and they're talking to you in what they think is a normal manner. But their stories are just, their lines of thoughts are all over the place, and they're constantly distracted and going off on constant tangents. A bit like a kid trying to tell a story, if you've ever been in that situation. Just to give you an example, another rare form of psychosis, or another presentation of psychosis, is catatonia. So you might have heard of this. Catatonic schizophrenia is when people are completely still and they have this thing called waxy flexibility, which means that you can move their hands into these weird positions and leave them, and they'll literally stand there for hours because of this intense psychosis. Not to be confused with body popping. The other thing that's important to know is that psychosis is a period or a state, as opposed to something that's permanent, like a personality disorder, which is like an inherent permanent flaw of one's character, or like a neurodevelopmental disorder like autism, which is lifelong. Psychosis, in theory, is a period of mental illness which can be cured, and you can go back to your normal baseline. In theory, because sometimes you get treatment resistant, etc., etc. One reason I made this video is because I think it's often misunderstood. The word psychosis is connected to somebody that does something completely irrational, particularly somebody that does something violent. They're described as psychotic. Like, for example, this person went on a psychotic killing spree. And I just want to make this absolutely crystal clear. The link between mental illness and violence is complicated, but somebody with a mental illness like schizophrenia, despite what the tabloids might say, is far more likely to be a victim of violence and far more likely to hurt themselves than other people. So despite what I've been talking about, it's actually very uncommon. The reason I talk about mental illness and offending so much on this channel is because those are the people that I see. As a consultant forensic psychiatrist, I assess them, as I said before, in courts and in prisons, etc., etc. Okay, so schizophrenia. How does schizophrenia fit into this? Is schizophrenia psychosis, etc., etc.? So schizophrenia is a recurrent tendency to have psychosis. So I like to compare this to seizures. So if you have one seizure, then that's just a seizure. If you have several seizures and you have it for the rest of your life, then you have epilepsy by definition. But it doesn't mean you're permanently having a seizure, it means a tendency to have seizures. So in the same way, schizophrenia is like repeated periods of psychosis. So it's lifelong. So what I'm saying is that all schizophrenia is psychosis, but not all psychosis is schizophrenia. Just like all obese people love cake, but not everybody that loves cake is obese. So if you're a subscriber to this channel, you will know that usually I tell you about criminal cases and I usually dissect the crossover between mental illness and true crime. If you're not a subscriber, then I hate you, and I hope the next time you're doing a number 2 in a public toilet, you run out of toilet paper. No, sorry, what I was going to say is what I'm going to do differently is I'm going to talk about a successful case of a person with schizophrenia, because I want to kind of help decrease the stigma. That's what I'm all about. So I mentioned him before. I'm going to tell you about John Nash, who was born on the 13th of June 1929, and he died on May the 23rd, 2015 at the age of 86. He was a senior research mathematician at Princeton University since 1994. He was amazing in what he did. He contributed to game theory, to differential geometry and partial differential equations. Now, I'm sure we've all written papers about these topics, sure, but this dude actually won a Nobel Prize in economic science. And what was special about him is he had severe schizophrenia and he spent several years in and out of psychiatric hospitals. He was treated with antipsychotic medications and was also treated with insulin shock therapy. In fact, his life was depicted in a book which was made into a film called A Beautiful Mind, sorry. It was directed by Richie Cunningham from Happy Days, and the main character was played by Gladiator, and he had visual hallucinations of Vision from the Avengers. As I said before, it's not actually that realistic to have these entire visual hallucinations and constructing a person who has like thoughts and feelings. It's mostly vague auditory hallucinations and voices. And if it is visual, it tends to be very bizarre visual kind of experiences, like seeing demons in the clouds, or you know, seeing like faces in the newspaper, in the wallpaper. It's not usually in the form of making an entire entity that you have conversations with. So that depiction in that particular film wasn't realistic. You know, I'm not saying the whole film wasn't, just that whole having that vision Paul Bettany did. By the way, if you're interested in me breaking down films and giving you my psychoanalysis of how realistic it is and whether the constructs they have in those films actually match with real life psychiatric patients and real life psychiatric symptoms, then you should go and check out my videos on Inventing Anna, the Netflix documentary where I do the psychopath test. And as I said, Joker, I did a psychoanalysis of how mental illness is depicted. I won't go into it now. I thought Joker was an amazing film, did things really well, made 1 or 2 small mistakes in relation to how it depicted mental illness. Anyway, let's move on. What causes psychosis? Very important question. Before I answer that, let me quickly introduce you to this channel. As I said, my name is Dr. 𝐏𝐬𝐲𝐜𝐡 𝐅𝐨𝐫. I'm a consultant forensic psychiatrist. I assess people in courts and prisons. I give expert evidence in criminal cases. You can call me the ominous 𝐏𝐬𝐲𝐜. I'm your favorite Asian British, London-based forensic psychiatrist, YouTuber, or at least in your top 3. This channel covers a smorgasbord of topics related to mental illness and offending. Sometimes I interview individuals. I've done a recent video on Putin, psychoanalyzing him. I've asked the question, is suicide selfish? I've looked at the psychology behind pathological lying. So if you like your true crime with a twist of psychiatry, you've got to check out this channel, fam. Just want to briefly explain why I made this channel. It's because I want to give my professional insights and I want to educate you, you dear viewers. I want you to start analysing and dissecting cases like a professional, both from a psychiatric and from a legal perspective. And to a degree, I want to take over the world, but we'll come on to that later. I implore you to subscribe. Not only does it help me out immeasurably, but if you don't, I'm going to come around to where you live. I'm going to wait till you're really late for work one day. I'm going to drive in front of you really, really slowly, and I'm not even going to let you overtake. So, what causes psychosis? Nobody knows for sure, but we know that there's factors that contribute, and they are biological factors, psychological factors, and social factors. So an example of biological factors would be a family history. Psychosis, like most mental illnesses, tends to run in families. Another biological factor might be like an in utero exposure to a certain virus, which means a virus infecting the pregnant mother. Then at certain times, certain types of viruses might make the child more susceptible to mental illness like schizophrenia. Psychological and social examples could be like extremely high stress, poverty. All these things are risk factors. They're not causative, but they're risk factors for schizophrenia. So for example, we know that people who live in cities or immigrants are marginally more likely to get schizophrenia than people that are not those things. And there are other physical causes, might be brain tumours, as I mentioned before. Then of course, I've not even talked about drug-induced psychosis. That deserves a whole category unto itself because it's like a different beast. It's renowned for certain substances caused by things like amphetamine, skunk cannabis, whereas other substances like heroin, alcohol are not renowned for causing drug-induced psychosis. It's kind of different to usual psychosis like schizophrenia because it's temporary and it only lasts while the substance is in the body, which makes it difficult to treat because antipsychotics take about 4 to 6 weeks before they start working, although the sedative effects of antipsychotics, or any sedative, can be quicker. So you can sedate people, but you can't really reverse a drug-induced psychosis in time because it doesn't last long enough to treat, if that makes sense. If you're interested in drug-induced psychosis, you're getting a pattern here. I've done a video, very interesting video. I kid you not, it's about a Wu-Tang Clan affiliate rapper called Christbearer who cut off his own penis when he had drug-induced psychosis. And if that doesn't whet your appetite enough, I've got another episode on drug-induced psychosis about a real-life case who I assessed of a man who stabbed himself in the cheek with a pair of scissors. This all happened. Okay. So I mentioned before the difference between psychosis and a psychopath. So I've already told you what psychosis is. So it's a temporary state of symptoms being out of touch with reality, hallucinations and delusions being the most common. A psychopath is not that at all. Psychopath is an ingrained personality disorder where somebody lacks empathy, doesn't care about the rights of wrong of others, doesn't care about breaking the law, is impulsive, is aggressive, far more likely to offend than somebody with psychosis. If you want case examples of those things, I would urge you to watch other videos on my channel. Andrea Yates, got a video on her. So she's a tragic case. She became psychotic, killed her 5 children due to these delusions and hallucinations. If you want an example of a psychopath, a good video I did is the DSPD program. So that's the dangerous and severe personality disorder. And I tell you about the case of Michael Stone, who was a psychopath who just randomly killed the Russell family for absolutely no reason. Horrific, horrible man. Okay, let's quickly talk about the different types of treatment. So psychosis is treated by antipsychotics and also cognitive behavioral therapy. So that is basically when you sit down and talk to a therapist and they try and get you to think through your thoughts and your actions to either decrease the stress of feeling those symptoms of psychosis, or even better, trying to help you interpret what's reality and what's fantasy so you gain some insight into your psychotic symptoms. Okay, briefly I'm going to answer the question, does everybody with psychosis need to be sectioned or treated in hospital? The answer is not necessarily. It's all about the level of functioning, and whether you're going to be sectioned in hospital is all about risk. So there are very specific criteria in the Mental Health Act. So to be sectionable, to be detained, you need admission either for your own health, for your safety, or for the safety of others. So quick examples of all three. Your own health might be that you're becoming increasingly psychotic, so the quicker you get medication, the less intense the voices are going to be. Your own safety might be suicide, so maybe the voices are goading you to hurt yourself, or it could be that you think random people are talking about you, so you're going up to strangers and challenging them, swearing at them, which obviously is not very good for your safety because you could get punched. Or the safety of others could be something like you believe that certain people looking at you in a funny way are spies intending to kill you, and you're having thoughts of taking a knife and doing something about it. All of those would be examples where there is a risk. So obviously that person has to be treated against their will if necessary, and they have to be sectioned. However, if you have a chronic delusion and there's no risk, then you don't have to be treated against your will. So if you're communicating with aliens, but you're not hurting anybody, or if you have this weird belief that you can inject bleach into your own veins to cure COVID, as long as you're not actually doing it to yourself or anybody else, there's no risk. So there's no reason for you to be treated against your will. So you could potentially live a fairly reasonable life. You could have a decent level of functioning. You wouldn't have to be in hospital. Perhaps you just saw a psychiatrist and as an outpatient. Perhaps you took medication, maybe you didn't. Perhaps you might run the most powerful country in the world for 4 years. So let's keep it moving. I ain't got no time for shucking and jiving. To conclude, what did we learn today, kids? We learned what psychosis is. We learned about hallucinations and delusions, but also the more subtler symptoms. We learned the difference between psychosis and a psychopath. We learned how schizophrenia fits into all this. If I didn't mention it, I've got a separate video on schizophrenia that goes into more details and more case examples. Go check it out. We learned that some people really shouldn't take mushrooms. We learned the kind of connection of whether psychosis leads to violence. And finally, we learnt about the case of John Nash, an amazing mathematician who had schizophrenia. Okay, please read my book. It's come out on the 10th of March. It's called Into Minds. Like this video, but a lot more educational, more of a deep dive, more personal, talking about my cases in a lot more depth. So you should get it because it'll educate you and also because it makes me money. If you can't read good, don't worry. I've done a version on audio on Audible. That's an audio version. I read it myself. Until next time, I implore you to tell people about this channel. I need more subs. I need the love. I wasn't hugged enough as a kid. I'm going to be going to CrimeCon UK in June, and I'm going to be on lots of panels talking about lots of clever things. Okay, whatever happens, stay euthymic, and please do not forget, I love you.